research and the implementation of this research. And then we'll go back to wrap it up and have a look at what are some of the recommendations that we have in terms of communicating with migrant communities throughout the COVID-19 crisis. If you have any questions and you'd like to be involved in the discussion, you can post those questions as we're going in the chat channel. You can also hold them off until the end. We have put aside 10 or 15 minutes at the end of this presentation to make sure we can have a really good discussion about some of the issues that we'll be raising. So just a really brief background on what our project has been doing in Asia. So for the last 4 months, we've been running an H2H funded project, which has been doing social listening in 9 languages. So we've been collecting rumours around COVID-19 in 9 different Asian and South Asian languages. And we've been using that information to analyse community fears and anxieties. And we've also been using it to support local media and community influencers in the region to make sure that we can let them know what their communities are talking about and then tool them up with the information they need to be able to respond to some of the key questions and concerns that are coming from their community. We've also been working with social media platforms to make sure that when we do find rumours, we're able to flag them and have them removed. And we're really focusing on here as well, as I said, the support of the media. With this overabundance of information that has been going around COVID-19, many people and many journalists are really just not without the skills to judge the quality or to sort fact from fiction. A lot of the information that's been flying around is also in English, so anyone that doesn't speak English or is not comfortable in English is already at a disadvantage. And media in general, right around the world, are really overwhelmed during this crisis with a severe dip in revenue through advertising revenue, but also with many reporters who may not have a background in health and science journalism now being expected to be experts on what is a really fast evolving crisis and a very complex one at that. So we've also been working throughout this project with Translators Without Borders, who've been wonderful in helping us to translate all of our information to make sure our guidance can be accessible to journalists across the region. Evidence Aid, who have been linking us with quality scientific research and helping us to sort quality research from the not so quality research in this also overabundance of scientific research that's going on at the moment, and BBC Media Action, who've been creating some really wonderful animations and other audio-based content to be able to inform communities in this crisis. And I guess some of you might be asking the question why we decided to focus on migrants. Internews has done information ecosystem assessments in many different crises before, and we've looked at many broader groups within a crisis. Usually we'll be looking at an entire country or an entire crisis-affected population. But this time we decided to focus on migrants because they really have some increased vulnerabilities in this crisis. You know, we saw in Thailand that many migrants lost their work, or their work was heavily impacted by movement restrictions. Some that did lose their job weren't able to cross back to their home countries. Some were able to cross before the borders shut, and that left many in quite a vulnerable situation around the border areas as well. Migrants in all contexts are more likely to have more challenging linguistic needs. So they're more likely to be in a country that doesn't speak the language that they prefer, they're most comfortable in speaking. That means that they might have trouble accessing quality information in the language that they can truly understand, especially when we're looking at COVID-19, when a lot of the information is quite scientific and quite complex. They also have unique information needs as well. I think that's something that it's really important to note, that while the people living within the country might have a certain level of information needs or certain questions about their rights and responsibilities in a crisis, migrants will have different needs. They're likely to use different platforms to communicate. They're likely to source information from different media, perhaps their home country media. And as I said, they do have different information needs to the average citizen, who might feel that they are covered by, government safety nets, whereas migrants might be feeling that their situation is a little bit more precarious. And something else that we've definitely seen in this crisis as well is that migrants have been facing increased stigma and discrimination. And that's right across the region and in many different contexts, where this is seen as an imported virus. And that means that anyone that is from another country is often seen as the source of the problem. And so because of this increased stigma and discrimination, you can see groups like migrants preferring not to seek hospital treatment, preferring not to be tested. And then you do see further outbreaks, as we saw in Singapore, for example, amongst the migrant population there in the dormitories. So I'll just hand over to Pamela, who is the lead researcher for this information ecosystem assessment, and she will take you through what she's found out over the last 3 months of research.
Hi, everybody. Thanks again for joining us today. And as Irene and Nisanee already pointed out, if there's any questions that arise, please go ahead and share them in the chat box. All right, as Irene already described, this research is part of a consortium of individuals organized by H2H Network, who are brought together to fight the global infodemic that is spreading more quickly than the COVID-19 pandemic itself. Understanding that as we're gathering information and tackling the infodemic from these different angles, it gives us the ability to identify relevant information and communication and media actors as a step to ensure the biggest impact of the work both that H2H is doing as well as some of our other partner organizations are doing in terms of understanding where in the communication ecosystem we can best attack and approach. On the right, you see here just a diagram of Internews' overall understanding of information ecosystem, that while we're starting with information needs and understanding the landscape, production movement of content, et cetera, allows us to go through a circular movement of understanding different components of communication and information channels and identifying where our work is most relevantly going to touch upon that network. So with respect to the population of migrants, I just wanted to give you a quick overview of who this population is. We understand that migrants in Thailand make up about 10% of the labor force overall, that they're coming from Cambodia, Laos, Myanmar, and Vietnam, that there's a pretty even split across gender in terms of who these migrants are in the country, about 52% male, 48% female, about half of these migrants working or having work permits issued to work in Bangkok, the rest working in other provinces. And the means for obtaining work permits is through both an MOU channel as well as a national verification process. This is pretty key in talking about migrants as well as during this period of time, as the renewal period for many of these work permits was in March. So as soon as the pandemic was hitting, a lot of people were not able to actually renew their work permits and then went into lapsed and expired permits. And while the government of Thailand has worked to extend the expiration of these permits, you'll see as we discuss this work that concern for work status and regular work status is something that constantly comes up with this population. Another interesting thing to point out is just a recent study that came out during the time that we were preparing and conducting this assessment that looked at literacy and listening skills of migrants in Thailand when it came to understanding Thai, both proficiency in reading, proficiency in understanding and listening to Thai. And this evaluation had found that less than 20% of migrants were proficient in listening and comprehending Thai, less than 10% proficient in reading Thai. And another interesting factor was this idea of a health literacy score. Health literacy score being an individual's ability to both access health information, understand it, and appraise and figure out how that information applies to their life. The assessment that I'm referencing found that only about 15% of migrants had a favorable health literacy score, so able to utilize health information. The methodology of this approach was a mixed methods approach, was quantitative and qualitative, with qualitative interviews focusing on key informant interviews with community leaders and community members, and a quantitative survey administered online through a Global Toolbox link. We focus on non-probability sampling of participants, so we started off with kind of a mix of convenience sampling and snowball sampling methods, while our entry points to the population were both through the NGOs who are on the ground, that Migrant Working Group helped us identify, as well as Facebook groups that we were able to find that had a large migrant audience, as well as the network of the interviewers that we actually hired, who were interviewers from Thailand who were Burmese, or from Cambodia, living in Cambodia, or who are Lao, also living in Thailand. And so many of them had already done work previously with migrant populations and kind of went back to these networks to help identify who they were going to approach. We used different audio platforms to conduct interviews, the qualitative interviews, and we were able to do these interviews in local languages, Burmese, Karen, Khmer, Lao, and Thai. And the themes of the questions for the qualitative and the quantitative questions were around communication channels. What are the main channels of information and communication available during this time, during the pandemic, as well as before the pandemic? What are the main information barriers that people are facing, trust for information, additional needs for information, and their comfort in communicating outside of their community? We aimed for a maximum variability approach when it came to sampling the qualitative population. And you'll notice here that I'm really focusing on describing our qualitative research rather than our quantitative research. While we had launched this survey quantitatively, we just had a lot of challenges around translation as well as reach to the population, and only 16 individuals participated in the quantitative. While the qualitative, we were able to reach saturation with interviewing 48 different individuals, split across gender, similarly to how the split across gender actually exists in the migrant population. We looked at interviewing about 30% community leaders, so these are individuals that could be either working for organizations, working in the government, acting as team leaders at a workplace, at a factory, etc. We interviewed 75% documented migrants and 25% undocumented. In the actual population of migrants in Thailand, it's estimated that 20% are irregular or undocumented. And we also looked to interview about half of individuals that have been working in Bangkok, and the other half outside of Bangkok. We also noticed that age was not something that we took into consideration for maximum variability, and as well as other characteristics, just because of the challenges that would pose towards remotely identifying participants and doing participant selection. While we could focus on gender, community role, work permit type, and work geography, being able to know the age of somebody before we actually spoke to them was going to be challenging. Being able to know other characteristics before we actually spoke to them was going to be challenging. So that's why we really focused on these. So going into the information sources that migrants are using during this time. So we asked the question to both leaders and to community members, who were where do you turn to for information during the pandemic? Members identified that really community leaders, team leaders, bosses, kind of people in notable positions of leadership were their main sources of information during this time, and also their main sources of information even before the pandemic. In terms of where these actual leaders access their information from, a lot of them access their information from different NGOs. See a few mentioned here, MAP Foundation, Migrant Working Group, IOM, as well as the Mesa and Maytao clinics in Thailand. Many leaders also communicate directly through embassy hotlines, calling up these hotlines to be able to pose and ask questions before disseminating it to their networks, as well as informal channels. And when we talk about informal channels, it's not to say that it's just a general person-to-person communication, but many leaders might just call up an individual that they know who works for the government, or call up an individual that they know who works in the organization that might be able to pass them on information. And so they're not necessarily using the formal channels of communication that have been set up with FAQs and hotlines, et cetera. They're just calling people up. And then also Thai government hotlines being utilized as well, but being one of the most least utilized information sources. In terms of communication channels, what are the main channels of information and communication available to you and your community during this pandemic? No surprise to many of the people on the ground, it is Facebook pages. One of our colleagues who works for MAP Foundation had stated how for many migrants and for many people in Thailand in general, the internet is Facebook, Facebook is the internet. It's two equivalent things. And when we talk about Facebook pages, we don't just mean any sort of pages, but also pages for television networks, pages for radio stations. People are more likely to access broadcasts on these pages rather than tuning into an actual TV or an actual radio, and they're gonna listen and watch over these pages. Facebook Messenger and Line being ways that people might cluster together in a group, either that group being informed by where they work or a group of friends, and Line being a platform that's similar to WhatsApp, where you can have a group of people chatting and sharing information across. In-person information shared either one-to-one in individual Facebook pages or individuals communicating in person is one of the less likely channels of communication during this time. Obviously, with social distancing, there's a lot less in-person interaction. And because there's so much group information, people weren't necessarily relying on just a single friend on Facebook on their page telling them information. Actual TVs, actual radios, not very commonly mentioned. Loudspeakers, where somebody has broadcast information driving through a community, also not often mentioned, but does have some recognition. Information barriers, understanding what, if anything, is preventing people from accessing information that they need now. Smartphone ownership and internet connectivity was the main barrier that migrants identified could inhibit them from being able to access the information that they needed. People noted that when they perhaps didn't have money for airtime or for internet, they might be more dependent on other sources at that time before they were able to get the money to be able to be connected back to the internet. But this kind of insistence that the internet is the main way, if you don't have internet, then you are at a loss for information. As Irene mentioned before, obviously language and literacy is also a big concern. People were, with a lot of information being disseminated in Thai and in English, there was a lot of reliance on other individuals to have to translate to local languages, and people really wanted to have more information available directly in their primary language. Actual communication or integration with Thai people is another barrier that was identified, that when people actually interacted directly with Thai people that could speak their language, that they were more likely to access information for them directly, but if not, they were reliant on these other channels. And competing priorities, I mean just people not having time to access information as another barrier that they identified, that their work hours were too long, that they were then just reliant on information that passed through them by their colleagues, and they weren't necessarily focused on accessing the news directly themselves. Information trust, in terms of what information sources are trusted the most, is very linked to kind of key information sources. So the people that are trusted the most being community leaders, team leaders, bosses, social media and other media being trusted. When information is repeated frequently, so they hear the same piece of information across several channels or by several of these networks, then they are likely to believe that it is true, regardless of how the initial doubts they might feel when they initially hear that information. Information coming from abroad is not as trusted, as many migrants felt that the information that they had access to in Thailand was probably better than the information that their friends and families back home had available to them. Person-to-person information is the least trusted. When either that can mean a friend directly telling another friend or somebody posting on their individual Facebook page, but because it's just coming one-to-one, there's a lot of doubts that that information is validated, and unless a community leader, team leader, or boss validates that information, people are less likely to trust it. In terms of information needs, during the pandemic, and again, reminding you that this is the period of time when visas were supposed to be able to be renewed. The biggest concern that migrants have is around labor rights, the visa status, and then governmental support to migrants. Obviously, there's an issue with being able to access income and being able to pay for rent and for food. So everybody's concern is really, really focused on, when am I going to start working again? Do I still have a visa? How can I apply for a visa? How can I apply for benefits? And then when they do not have information about that, being able to understand, when can I just go back home? I don't have what I need here in this country. I would like to know when the border is going to reopen. How can I repatriate? And then third kind of comes in the access to health services and location of services and eligibility for those services. And so this is not to mean that people are not concerned about COVID-19, but many migrants felt that they had sufficient information about risks, prevention, symptoms, that they didn't really have a need for that information still. Another concern for migrants is just, when will this pandemic be over? What's happening next? When am I going to be able to get back to work? When can I leave from where I am? And then one of the least the least prevalent information needs around information on prevention and symptoms. Again, because people felt that they had a lot of this information already, or they didn't have any issues with accessing that sort of information. There's also some mention of wanting to have training, education, being able to learn Thai, being able to take a new skill on so they can get some work during this period of time. In terms of safety and security, so we asked the question, is it always safe to share information with other people in your community? What kind of feels the most safe for you? Migrants felt that within their community, they felt very safe sharing information. They felt very safe discussing information on health, especially. There's a little bit more concern for discussing information about their work permit status and visa status, or that this is something that influences people. When people did have their visa or their work permit was still valid, they felt a lot of security in this, and they felt a lot of security around their movement. When individuals do not are undocumented or are regular migrants, there's a lot of fear and a lot of concern for this. There was a mention in the Burmese communities coming from Myanmar about internal community conflicts and discord, and how that impacts individuals' sense of safety, and how that also leaves them vulnerable for kind of verbal attacks from other members of their community. Individuals do not feel safe discussing politics during this time, but there wasn't like a high need mentioned to discuss politics, as they were really focused on their health and around their work permit status. And I'm going to go ahead and pass over the conversation to our colleague Nisanee from Raks Foundation to kind of get her first reaction to some of the evidence that came from our assessment, and also hear a little bit more about what Raks Foundation is doing during this time.
Thank you, Pamela. My name is Nisanee. I'm a research M&E officer from Raks Foundation. And today I would like to give a little bit of our organization background on our work on migrants in Thailand. Raks Foundation was a former Care International. We started our work with refugees from Khmer Rouge period starting in 1979, and then we become independent, but still a member, and we register as a member of Care International and become Care Thailand and register as Thai NGO. And since 2003, we have been working with migrant communities.
Nisanee, I think there's a bit of problem with your mic. Can you get closer to your computer? Okay. And I think there's some background noise. See?
Better? Is it better?
Okay, it's much better. Thank you, Nisanee.
Okay, sorry. Okay, so we start working on migrant health from 2003 under the Global Fund funding, and the Global Fund to fight AIDS, tuberculosis, and malaria. So now we work on those three diseases with migrant communities. And in 2009, we started working on migrant rights project and continue up until today. And today we work with migrant and ethnic minority communities in 13 provinces across Thailand. And since the COVID-19 pandemic has panned out, we have responded to the crisis, especially for the migrant community across Thailand. We partner with Department of Disease Control and WHO, providing a COVID-19 hotline in Burmese, Khmer, and Lao. So our staff act as volunteers and provide the information on COVID with a training from Department of Disease Control. And we also conducted 2 separate studies. So the first studies focus on a very initial phase of the COVID pandemic, and we focus quite broadly on access to health system, preventive measures, understanding on risk, behavior concerns, and also impact on employment, travel, and inclusion. And another research project, we conducted a rapid gender analysis, which we focus on the gender aspect and the impact that the impact of COVID-19 that has on male and female migrant differently. So we focus on gender division of labor, access to health service, decision making in household, gender-based vulnerabilities, and need assessment. And the key findings I really complement Pamela's presentation. And in terms of the livelihood, migrants lose at least 50% of their income due to the COVID pandemic. And female migrants are impacted by cuts to working hours more than male migrants. For employers, they have not put enough effort to help the workers with health and safety measures, especially in smaller establishments or the factories. And the border closure also caused a lot of frustration and financial burden for migrants, because especially from pregnant migrants who really, some of them are really want to go home so they can be safer and can deliver their child at home with their family. But there's a lot of problem and obstacle to travel across the border at the moment. And that's linked to the voluntary repatriation program that is not really affordable at the moment and is not gender responsive. And only documented migrant can afford to enter the repatriation program. And also there's a quite significant findings show that a lot of migrants really in need of cash to pay rent, since so many of them have lost their job or has been suspended due to the COVID-19 economic impact. And in terms of the access to information, for the 2 studies that we conducted, we did not specifically focus on access to information. So I think Internews report really kind of complement our work and has been really useful and valuable resources for us to use and improve our work in community health. And so from our finding, we also share the same similar finding that social media and online was the most used source of information, especially for male migrant. But for female migrant, we found that female migrant has a lot less access to mobile phones. And because a lot of them, especially fishermen's housewives who stay in the shore and their husbands or partner go out in the sea to work as a fisherman, most of them, a lot of them do not have correct documentation. So without a documentation, they cannot get a Thai mobile phone number and register. So therefore they cannot have, they kind of lack the mobile phone and therefore cannot have the access to the information on their own. So what they did is that the housewives or the ladies, the female migrants, would usually share their phone. So if someone have one mobile phone, the female migrants will go and hang out, and then they share information from Facebook of one person and then share among 4 or 5 housewives. So if you need any more information, you can contact through my email or visit our website. Our report will launch probably, hopefully within this week. So we'll keep you updated. Thank you.
Thank you, Nisanee. So I wanted to also emphasize again one of Nisanee's points, which was around the ability of migrants to feel that this situation was more in their control. Nisanee noted that, many migrants didn't feel like it was in their control to protect themselves and to take health measures to protect themselves from transmission. And we also saw in our work that many migrants stated that when it came to restrictions on movement, when it came to the stay-at-home ordinance, that because of the overwhelming need for money during this time and to work, they didn't feel that they were really able to apply this recommendation to their own lives, that they still had to go out there, that their employers did have to risk fines in order to have some workforce still active. So just going towards some of our recommendations coming from this work, primarily strategic use of social media. One thing that we found is that many of this information around labor rights and visa extensions, et cetera, and work permits exists, or understanding the ability for irregular migrants to be able to stay in country, even if they're not able to work in country, is out there, but a lot of this information is not known. So while there might be existing hotlines, while the information is available in local languages, there needs to be a better effort to kind of utilize Facebook or Line to increase awareness of these available resources. Another key tangible recommendation is for the Myanmar embassy in Thailand to relaunch their Facebook page. We saw reliance on embassies for information as quite a common need or desire by migrants. Many of them felt that the Thai government was less responsible for them than their own government, and their existence and presence in Thailand should be responsible for them. And I noticed that on the Myanmar embassy in Thailand page, the last post that they had was from September 2014. They only have about 2,000 followers right now, whereas the embassy for Cambodia in Bangkok has a very active Facebook page, a lot of text information, photo information, video information. They have 40,000 followers. There's a chat bot that kind of submits a question out to a person, like, is there a way that someone can ask if there's somebody available to talk to, if someone can answer questions for them. So I think this sort of dynamic interaction by the Myanmar embassy through their Facebook would be extremely helpful, considering that a majority of migrants in Thailand are from Myanmar. Also using social media as a key entry point to try to directly misaddress misinformation, both being able to bring it up and addressing common rumors. We noticed an effort by BBC Media Action that had a campaign where there's a video that goes out discussing, is information true, is it helpful, is it kind, and goes through some common rumors and goes through the process that one can go through to be able to understand when information might be misinformation or might be untrue. And efforts like that and campaigns like that would be very useful if conducted on social media. Another recommendation is to rethink migrant-friendly health services. There was a big effort by the Thai government to create these community health workers and community volunteers who were coming from the same countries of migrants, spoke their languages, and were interacting and out in the communities to be able to deliver services or bring people in for services. And obviously there's a limitation in how much activity they can do on the ground due to social distancing recommendations and lockdown measures. So being able to understand how can those same community health workers and volunteers kind of repurpose their goals and their work. How can they be used to serve in clinics to help be patient navigators and be able to address a lot of the stigma that migrants feel from Thai health staff. And also, how can they be kind of advocates to clearly communicate both the cost and the points of access for health services. Also being able to adapt communication content. We want to see more of a formal linkage between organizations that are producing content in migrant languages and the Thai government. Many people felt that there's some information that they could understand from the Thai government. They wanted to be able to have access directly to that information. They wanted to be able to go and say that the Thai government is their main source of information, but language is the biggest barrier in being able to do that. And while many organizations are translating and producing that content and disseminating that content, I think a more formal partnership that is very obvious to migrants would be very helpful. Also increasing video, audio, and communicative images. When Thai language isn't understood by migrants, clear images that describe, what are the prevention measures, what are the symptoms, were very helpful. And investing in other sort of imagery and graphics would be useful for this population. And video content and audio content also being more useful rather than written content. Also being able to consult with migrants in order to understand what is the terminology that is most clear to them when it comes to health information. I mentioned earlier about this concept of health literacy, and migrants said that a lot of the barriers that they felt was just around exact terminology of phrases were just a little bit unclear. So when these phrases are kind of broken down, they could understand them in Thai, but the way that they stand right now is a little bit difficult. Also being able to utilize appropriate and sensitive terminology and for migrants. So use of the word cross-border migrants versus legal and documented, etc. Ensuring that hotlines are available free and well publicized, and focusing content on the needs and concerns identified by migrants themselves. Also targeting key influencers, as we understand that these leaders in these communities are the main way that migrants are accessing their information, making sure that there's clear channels and reliable channels for these leaders, for employers, et cetera, to access information, and also utilizing these channels as a way, again, to mitigate misinformation. Because there's kind of a blanket acceptance of information that comes from leaders, they are a key gateway into how misinformation enters communities. Another consideration, obviously, the people that we talked to were highly connected individuals that we were able to call over their smartphones or by phone. And considering the needs for populations that do not have this connectivity, as Nisanee mentioned, fishing communities, families of fishing communities, families of agricultural communities, and looking at some of these sources around radio and loudspeakers and how they can be utilized to ensure information is disseminated in remote and less connected areas. And that is all I have for today. So I don't know if we want to shift over to questions. Sunny, if you can help us with that.
All right. Yes. Okay. There are some questions here. I think questions that were sent earlier to that came in earlier. One of the questions is with regard to shelters, temporary shelters and camps, and how do you ensure that you practice social isolation or physical distancing in crowded conditions. Yeah? And I think I'll pass it over to Irene. She has two other questions that she received. Okay. Yes. Maybe I can direct that to Irene, and Irene can channel the question to either Pamela or Nisanee. Yeah?
Hi, yeah, thank you. I'm just trying to clear my screen so I can actually see what the questions were that came through. I wanted to reiterate as well, I know a few people in the questions have been asking for the slides of this presentation, which is great. And yes, of course, we've made a recording of this as well. This is actually a launch of a report. So we'll also be sending out the report to everyone that's involved in this launch later on today, as well as obviously sharing it more widely around the media and humanitarian community in Thailand as well. So you'll definitely get another chance to be able to have another look at some of the information that's been shared today. I wanted to throw this question over to Pamela. There was a question that came in around, did we see a difference many differences in terms of the information needs between documented and undocumented migrants? Did you see much in your data that came in that showed that they had drastically different information needs?
I think the main difference was sense of security in the current situation. Documented migrants felt a lot more secure in being able to access health services, and were more likely to report knowing where to go, how to go, and not necessarily seeing as much of a barrier in accessing, identifying health services, where irregular migrants did not want to show up at a clinic. They felt that they were going to be stigmatized there, that they were going to leave themselves vulnerable to be deported or to be fined or to be imprisoned if an employee of a health facility knew that they were an irregular or undocumented migrant. Just a lot more fear of like how their movement around the community was, as well as really in both populations, both documented and irregular migrants, there was a fairly high desire to know when borders were going to reopen and when they could go back to their home countries and possibly seek financial support or seek work back from their home countries. So not as much of a difference there.
Fantastic. And there was one other question that came through as well that was asking about information flows from migrants back to service providers and to the government. And I know you spoke about this briefly in your presentation, but have you got any great examples of how migrants were able to give some feedback to government communicators or to possibly migrant organizations that were also providing them information in this crisis?
I think the main example that we saw was less about health services and more about legal and work issues related to work permits, where we had a community leader kind of be the information connector with a legal organization that provided services for migrants, and is both informing that legal organization of like what information needs migrants have around their work status at that time, and then being able to transfer information from that organization back to the population of migrants that he was working with at that time. When it came to health services and accessing, both knowing the eligibility of your Social Security or of your current health insurance to be able to access, we didn't see as much of a two-way communication flow and clarification of those questions with migrants. So while, again, there's a lot of information about prevention, a lot of information about symptoms, there's still kind of a gap in the two-way communication when it comes to how does one access health services, how do you find a health clinic.
Okay, and we have had a question that's come in from Napat from UNICEF, and we do invite everyone to share questions if they have them in the chat channel. Napat would like to know, well, firstly, says very interesting and useful information, and wants to know a little bit more about what type of Facebook pages and groups are the main sources of information for migrants. Are they pages from their home country or from organizations within Thailand?
Irene, just a reminder, if you want to, can you start your video because this is recorded, yeah, and be good to have a face.
Sure. So did you want me to repeat that question, Pamela?
No, I heard the question. Majority of the information that migrants are accessing on Facebook is coming through a specific network of Thai television channels. So I think Channel 3, Channel 5, Channel 7, and Channel 9. The MAP Foundation's Facebook page, and then other pages that exist in Thailand, either for migrants in Thailand, but much less mention of pages from their home country. There is a Burmese television station that is headquartered in Bangkok that also has a Facebook page that many people reference. And when our report actually goes out, we compiled every single page that all respondents noted in the interviews, and we have about a list of, I think, 50 or something Facebook pages that we'll be able to make available in public to you.
Yeah, that's right. They'll be in the annex of the report. So when it is released, if you just go to the end of the report, you'll be able to see a list of groups that are regularly accessed, and you know how large those groups are and what they're accessed for. So it's a really helpful resource there if you are working with migrants in Thailand. Another part of the question from Napat was around, did you notice any difference in access to social media among different age groups, for example? And perhaps, Nisanee, you can give us some insight into whether there are different types of platforms or different types of groups that are used by different age groups of migrants.
Nisanee, sorry.
Okay. Hello. Okay. I just want to answer the question about the shelter. That's the one. I think that was the first question. So I think social distancing is somewhat is really something that some of the migrants cannot afford because they have to go work in a factory or in a very crowded area. And part of our recommendation is temporary housings as well, a shelter for migrants who could not afford to pay rent anymore and also could not go home due to the border closure. So I think this is really urgent, and as well as cash vouchers. And this is the needs the most the most urgent and the most mentioned type of need that migrant want at this moment. And in terms of grouping of the migrants, so from Raks Thai, in addition to online that I already mentioned, that undocumented migrants, they wouldn't have a mobile phone, so they wouldn't have direct access to the information, health information, anything on Facebook or social media. So I think it's really important that we mix I really like the recommendation from Pamela on the strategic use of social media and online communication. And I think it's much needed to kind of combine and link somehow with the traditional community outreach, but also to remain remote as much as possible to ensure that migrants and our community health staff do not get contacted with the disease. Thank you.
Maybe I'll throw that question to you, Pamela, as well. I know that you said that in your data you weren't differentiating between age groups because that was quite difficult. But did you see anecdotally any difference in social media use between different age groups?
I mean, we saw that still individuals like across the board were all using social media, but again, that might be indicative. Sorry, my dog is here. That might be indicative of how we actually sampled our participants. That these were obviously a lot of people that were connected. And we still saw though, like individuals 50, 60, et cetera, and above were still on social media. But that younger individuals were probably more likely to be in line groups with friends or Facebook Messenger groups with friends, whereas older individuals were more likely to reference the groups that they were in being groups with like coworkers. We also saw, I think there's another part of that question that asks about nationality. And in terms of nationality, I think the biggest difference is just from Lao migrants, that they were less likely to be integrated in a community of Lao migrants because they felt that their language is close enough to Thai, and that they could understand Thai, that they weren't necessarily as dependent on one another to get information or be like a source of support to them in Thailand. Whereas Burmese and Cambodian migrants were much more likely to interact with other Burmese or Cambodian migrants, and much more likely to be dependent on those sources of support from their community.
Okay, and we have a question here from Han from the Mixed Migration Centre. The question relates to migrants losing their jobs during COVID-19, and some have continued to work, but are there any findings on the relationship between COVID-19 and an increase in labour exploitation? That's not so much what our report was looking at. We were very much focusing on how migrants are accessing and sharing information in this crisis. But I wonder, I'll put this out to Pamela and Nisanee. Did you have any thoughts to share, or did you have any information that you found around migrants losing their jobs and an increase in labour exploitation in this crisis?
I can. Yeah, go ahead, Nisanee.
Go. Oh, okay. Sorry. From our data collection, I think there's one case that are quite kind of it is in a form of exploitation, because the female migrant that we interviewed, she was pregnant, and she worked at a small scale seafood factory. And the way she get paid is that she get paid based on the number of kilos of fish that she can process. But for her husband, who worked at the same factory, he doesn't get paid like that. He get paid as a salary. And at the moment that the demand is reduced, and therefore she's the only one who get paid less than the male migrant workers. So I think it's not. In this case, it's the structural system that make the female migrant vulnerable than others, especially those without documents.
And Pamela, you wanted to add something to that question as well.
Yeah, from our end, we saw that domestic workers who are often living with families were less likely to report exploitation, but individuals who were working on factories or farms, there was some mention of, even when they did know their labor rights, they didn't know how to approach their employers to respect those labor rights. So for instance, there is a contingency by the Thai government that if somebody is made redundant and loses their job, they do deserve severance for a certain period of time. And there was 1 or 2 migrants that reported that they knew they deserved severance from their employer, but didn't really know how to carry that out and how to approach their employer with that. And organizations that typically support them in carrying out those sort of support were unable to, because of the remoteness of the nature of communication during this time. And also, one of the least trusted individuals reported by a few migrants were brokers who would negotiate, crossing back over into the home country. Many people felt that brokers were exploiting them financially, that they were giving them misinformation about when borders were reopening so that they could get money from them. So there was quite some mention of that.
Okay, thank you. We just have 5 minutes left on this webinar, and I wanted to put the question out to the participants as well, whether they had any examples where they had seen some quality communication practices where migrants, systems have been set up so migrants could access the information they need, any examples from their work, or of course any questions you might have for the panelists. Feel free to put on your microphone and you can ask away. Okay, people are shy today, that's fine. So I did want to mention when we do release this report, we will be sharing it as well on the Internews COVID-19 website. So that's just internewscovid19.org. That's where we've been sharing all of our rumour bulletins and also resources for journalists and communicators over the last 4 months of this project. Unfortunately, we are closing down this project, but happy to say that I'm sure that another quality Internews project will be jumping into its shoes very shortly, but that website will remain open. So we will continue to add to the internewscovid19.org website with further resources for journalists produced from our Internews projects right around the world. So it will definitely stay up, and you definitely should stay tuned to that website and have a look at some of the resources there. We've done some really in-depth responses to some of the key rumours that have been circulating around the region, but also guidance for journalists. As we mentioned earlier, they're in quite a precarious position in this crisis. Their safety is at risk. There have been a number of journalist deaths already. And also, of course, they're trying to grapple with reporting on what is a fast evolving and very complex situation. So a lot of explainers there for journalists around vaccine development and clinical trials and some of these complex issues as well. So do stay in touch. You can also contact us through that website, or of course, you can contact Pamela or myself on our email addresses. I'm just going to put them up on the screen so you can see all of our contact details right there. Okay. Hopefully that will be coming up there. There we go. So you have our contact details. Do stay in touch. We will be, as I said, still continuing to produce more resources for journalists and communicators in the region. And of course, do send us feedback once you have the report. We'd be really interested to know whether you use it in your work, whether it's useful, or if there are other reports that might be useful to help fill some information gaps for yourself and your work as well. So unless there's any more questions on the floor, I'm happy to close the meeting. And thank you everyone for coming along. We really appreciate it. And keep an eye on your inbox.
Thank you, everybody.
Thank you very much, everyone.
Thank you.